One of the tricky issues is that most mental health care services and addiction care services and even suicide prevention care services are not fundamentally integrated into our health ecosystem that is publicly covered, right? Most mental health care services are through employer benefits or through community services like CMHA, or you pay out of pocket. And so right there is a challenge and a limitation that separates the public healthcare system from mental health services and addiction health services, because we all recognize the importance of having good mental health. We can speak until we are blue in the face about its role in, economic productivity, which is, a very timely subject. We can talk about it in terms of affordability, that people cannot afford about it, which is also a timely subject. But ultimately, if the system is built in such a way that deprioritizes mental health care, then it is very difficult to sort of surmount that. And so one of the things that I've been giving a lot of care and thought to is how we actually, the language that we use and how we actually talk about mental health. And it's often in terms of programming, right? Whereas when we talk about emergency care or hospital care, it's in terms of services. And I think that that language is very powerful, because mental health care programming seems more like a ancillary social good versus an essential service. You wouldn't cut an essential service, right? We couldn't possibly imagine the government saying, well, we are in a moment of austerity and therefore we're going to cut, ambulance services by half. Right? That would be unimaginable that we would do that. But we tolerate cuts to mental health because it's seen as either a nice to have or seen as, well, the responsibility of employers to cover through benefits. And so how do we reframe mental health as an essential service? And I think that that's a very strong starting point, because we don't have the starting point in legislation. Right? Mental health care isn't covered under the Canada Health Act the same way that physical health is. And so you're already coming at it from a bit of a deficit question. And so I think as a starting point, it's maybe reframing how we talk about mental health, right? And not permitting ourselves to talk about it in softer terms, right? And talking about it as an absolute necessity for individuals and for our society.
I think that's such a powerful way to reframe this piece. And I think you're right, especially now when we have conversations about geopolitical and socioeconomic complexity. And definitely these conversations are grounded in these not only national, global sentiments of austerity.
Yeah.
And that's where we get into the conversations about, well, what needs to go? What's a nice to have, to your point? And you spoke a little bit about the data is there to demonstrate the business case for investment in mental health. But then that's part of coming back to our earlier conversation, that story and that narrative, and making things really clear and concise. And one thing that I think we are getting better at, in alignment with your essential service point, but still have a bit of a way to go, is really articulating the direct output of investment in mental health and substance use health.